Welcome everyone to the second in our career conversation series for the life sciences. And tonight we have a special pleasure having one of our own alums. This is Dr. Kevin Lane, and he's in the class of 2001, 2002, depending on who you want to talk to about that. Class of 2001, but he came back in the additional year just to find his wife, as I understand it. So he's currently an assistant professor in the Department of Environmental Health at the Boston University School of Public Health. And I won't tell you all of his degrees and so forth, although the most important one, of course, is St. Michael's undergraduate degree. But he also did a postdoc at Yale and a PhD at BU. So he's been to some other very fine institutions in the Northeast. Received a number of grants and awards, teaching awards, fellowships. What I find very interesting about his work is the way in which it is so interdisciplinary and really involves a lot of systems thinking about environmental health. And he's going to explain exactly what he does and what environmental health is this evening. So if you have questions about that, just wait a minute. But he's really interested in health disparities too, which I think coming from St. Michael's, a lot of us are very interested in the differential impact of things like climate change on the most vulnerable population. So he's trying to understand what are those factors that put people more at risk than other people. So it's really a very worthwhile type of research that you do, Kevin. Then he did give me a couple of fun facts, which he said I can share, so I will do that. First of all, I mentioned his wife. I guess he met her in lab, so you never know where you're going to find your life partner. He also lived in the AIDS awareness house, or a residence hall, or a floor, I guess it was, which we don't do that too much anymore, but I can remember when that was available to people. And he also was on the varsity ice hockey team the year they went to the won the national championship for Division II, right? Like 1998, right? Or 97, 98.
98, yep, you got it right.
98,
99 year, yeah.
I see the flag hanging up in Ross Tarrant, so.
That's how I got my broken nose, so.
Well, you have lots of very interested students here tonight from many different fields. So Kevin, I'll turn it over to you, and welcome to back to St. Michael's.
Oh, thanks a lot. And thank you for that introduction. I'm just gonna pull up some slides, but that's only to help, form and drive some of the conversation that we're gonna go here tonight. Really, it's a pleasure to be back. While I've come to the campus and visited a couple times and brought back some great memories, I haven't actually come and formally talk. So this is really a pleasure and a treat for me. And I'm going to do back to back. I'm going to do one this week, and then I'm going to come back and talk about my research next week as well. So this is going to be a lot of fun, hitting up St. Mike's 2 times in a row. So appreciate that. And while we can't be there in person, we should all take, I really appreciate, you all taking the time to be here today on Zoom. It's one of the last things that we want to do, get on yet another Zoom. But this is actually a fun setting for me, as opposed to like all the other meetings I have to do around budgets or things like that. So I'm really hoping that, over the next 20, 30 minutes, I'll take you through some of the areas that Karen said these conversations are about, to help give you a little bit understanding on my career path, how I got to where I am, what is an environmental health researcher, and what does a typical day in my life really look like, to give you a little bit more background. And then I'm really looking forward to some conversations as well. While I have like a whole bunch of slides here, don't be worried, I'm not here to lecture. I punish people enough with that when I teach. Instead, they're there in case questions come up and you want to ask me, like, well, what do you do with climate change? What do you do with air pollution? And so on. I have those already prepared and ready in case there's any questions on that. Also, I just want to start off and preface that my email is at the bottom here. If you want to reach out to me, super easy to find, klane@bu.edu. And I love talking with undergraduate students. While I haven't had any undergraduate students from St. Mike's currently do like internships with me, usually due to the proximity, those ideas are starting to change and things like that. So a lot of my studies I work on, I actually have students from local in Boston, either undergraduates or even high school students come and work with me as well. because it's highly relevant to the areas that they live in or their interests and they want to learn further. So that's my one plug, Karen, for self. If there's students interested in learning more, want to get more experiences. In terms of what I was going to cover just in the next 20, 30 minutes, I think I start off with like, how did I even end up here, and walk you through that. And really, it's a long, winding story that has a couple different tracks. There's an academic and a work track, because unlike a lot of some of my other colleagues that they knew what they wanted to do on day one, or even like not even day one of after graduation, like junior, senior year, I did not. I had a general area of interest and I wandered all over the place. Even in my undergrad, I wandered. And that's why it took me an extra year to get that second major. And then I figured, we'll go through that, the academic, the work piece. And then I also have a couple other type of tangents that we might want to talk about, like, because if anyone does GIS here or geographic information systems, I love it. Like, mapping has become like a central element of my work. I teach it. I do it every single day. And it's even become sort of like a form of art to me as well. So that wasn't the case. I had to struggle through, learn it. And there was no GIS, like public health courses back when I was learning. So I had to struggle by failing and just learning on my own. And now that's a central part of my teaching. And then research that I conduct. As Karen mentioned, like, I love, and really a passion that for me is environmental justice, and working on those projects in both local Boston area, but also national and internationally as well. And it flows into a variety of different areas. It's air pollution, it's built environment, it's social determinants of health. So it's in trying to not just do great research, but also work with communities on what we refer to as community-based participatory research, and integrating that in so we can get the data and the information out into the communities, the policymakers, so that we can help potentially affect change, and doing that on multiple different scales. That's really a passion of why I love to work in public health, and hopefully that will come across in my talk tonight. Okay. And I think, Karen, just let me make sure, the way you want me to do this is you want me to talk for 20, 30 minutes, and then we can open it up? No interruptions, or what would you like?
If people have questions that, if people want to send something to the chat, and if I think it seems like something we should answer right away, I'll let you know.
Go right ahead. I have no problem being interrupted when I talk.
Yeah. Okay, so guys, if you have any questions or need clarification, just send a chat and I will read it, and we can interrupt if we have to. Sure.
So in order to say, like, how would I end up here again at St. Mike's, I need to start off where I began at St. Mike's as well. So I did a double major in biology and political science, predominantly because I didn't know what I wanted to do. I didn't know if I wanted to be a med student. I didn't know if I wanted to go and become a lawyer. And that's sort of been a theme even after I was an undergrad, you'll see. And I was preparing myself for potentially both paths. And I think at the time it also was because I didn't know how to define what I was looking for. At the time, there wasn't environmental health. There wasn't a public health program. There wasn't that sort of infrastructure at St. Mike's that you have now to help me identify that these are potential career opportunities and paths to go down. At the time, it was basically like you did biology, biochemistry, or potentially just chemistry at the time if you were in the sciences, and that's really the direction that you went, and that was the flavors of opportunity. Yes, there was a little bit more flavor to that, but now you have a whole host of different opportunities, not just at St. Michael's, but also at different universities as well, and especially things like environmental exposure type paths, environmental science, environmental engineering. Those programs are just proliferating everywhere in the directions that you can go. So I think I was trying to already blend these two without realizing it. And really my passion for public health and working in, environmental science started when I applied for this New England Board of Higher Education fellowship my junior year, where I worked with the Department of Environmental Science at New Hampshire and Concord. And I spent the summer just going around collecting like big PM10 size particle things out of these filters, out of these big things. I had no idea what I was getting into. They were just said, can you lift 50 pounds? You got the position. and it was great. It gave me like $2,000. I worked 40 hours a week over the summer, and I learned about air pollution for my very first time. I came back and I was like, this is really neat. I'd like to learn more afterwards. And while I was in that fifth year in 2002, I actually was working at Paul Frank & Collins, which is a law firm right down on 1 Church Street. And I was actually considering, because I love political science, I was thinking maybe I want to go become a lawyer. So I worked there for a year. And you'll see that this is a natural theme throughout this thing. As I worked there, I started to learn what lawyers did by working for them. I was just a tech runner. So I'd be like one of those people where I'd have my business shoes on, I'd introduce everyone, I'd be copying papers, filing things, helping with the paralegal work. But then also at the last minute, they'd be like, all right, we got to file this brief, get it down to the courthouse. And I have to sprint right down Church Street and get it in there. And they'd literally be like, can you run down to the bottom of Church Street in 5 minutes? Good. Then we get up to that 5 minutes before they close and lock the doors. So, but I got to see, that's the fun stories, but I got to see what lawyers did. And by immersing myself in that, I realized, maybe this isn't for me. What they focus on, it wasn't my passion there. And that led me to applying for a job to go work with the Harvard School of Public Health. But before I jump in there, a couple of themes I'm going to talk about tonight is like the education and the work. And you're going to see that every time I talk about the education, there's a gap. And really when you're going in and if you potentially want to go into get a PhD or become that level, there's different systems that you can go. You can go right from the undergrad into a PhD. You can go undergrad to a master to a PhD if you want. And why the PhD? Sometimes it has to do with the level of depth that you want to know about a topic, or also meeting certain requirements in terms of your understanding of knowledge, so that if you want to become an educator at that certain level, you have the qualifications to be able to put that hat on and do it. But for me, it was a combination of both. I love a specific area of research, and it took me a very long time to get there. So I'm going to stop on the work page before I do that and just very quickly talk about my track on education here. And that's where, after St. Michael's, I actually went and worked at Harvard for a little bit, and I'll come back to that in a moment. But I took that next step in between. It took me, as you can see, when I graduated in 2002, I didn't actually attend Tufts until 2006. So I spent 4 years working on a research study. But I got a master's in urban environmental policy and planning. And then I got my PhD in environmental health. So you can see like this back and forth. Even when I was at St. Michael's, I was like, all right, I'm interested in biology and political science. But when I did my master's, I went back to policy, even though I was working in sciences. And then for my PhD, I went into environmental health, which is very hardcore public health. And in that case, I integrated in all my knowledge, the different disciplines I was receiving that training. And it really has paid off in terms of my next steps and where I went. And then typically I did a postdoc. So just to understand the career path typically of a public health researcher, where research is really the end goal, because I work at a graduate school. So the BU School of Public Health is different from the Boston University Charles River campus, which has, both undergrad and graduate students. We only have master's and PhD students and postdocs in my school. We don't have undergrads in it. We have a 4+1 program, which allows students to matriculate over from that undergrad directly into the program, but it's a very different setup. In a school like a BU School of Public Health, other schools of public health at Johns Hopkins, Columbia, Harvard, the primary focus is on research. Yes, you teach, yes, you mentor, but at least typically 65 to 70% of your time is spent entirely on research as opposed to teaching. And that's a critical thing to understand. If you feel like you really have a passion for teaching, that's different. Like you might teach at undergrad university or on like Charles River campus. You might teach like 3 or 4 courses potentially a semester if you're an undergrad professor. I teach like 1 class a year. That's it. And that's because my rest of my time I'm mentoring, which is much more of a one-on-one teaching relationship, and I'm doing research. And I'm publishing grants, publishing papers, and I'm presenting. And that's really a key difference. I'm not sure I understood even when I was in undergrad, that within the academic institutions themselves, depend upon what you're looking for, the trajectory of careers can be completely different from one another as well. Just some other experiences, and I'll pop back and forth on some of these things. So getting back to my story here. So what I did is after I graduated is I took a position at the Harvard School of Public Health in Shannon Laboratory, which is, if anyone's from the Boston area, it's just over by Brigham and Women's Hospital. So it's really nice place. It's right near Fenway Park. I was totally excited. I applied for this position while I was still a student at St. Mike's, and I ended up being a part of this really unique study where I spent 1 week every month flying to a different part of North America. And this study focused on collecting air pollution data and cardiovascular health measures, such as, we would take blood pressure, we would take urine samples, blood samples from Teamsters, and also put like mobile air pollution monitoring devices on them and in their trucks. It was such a fantastic study. And I was a part of a 4-person team where we spent 4 years traveling around doing this work together. And it was really an amazing opportunity to see a lot of North America. But one of the things I noticed while I was on this is, yes, we were collecting the data. It was an occupational health study. Occupational health falls typically also into a couple different master's and graduate programs. Industrial hygiene is the older version, although industrial hygiene programs have sort of gone by the wayside to just now become occupational health programs embedded typically within environmental and occupational health departments or environmental health departments themselves. So industrial hygiene at the time when I came out was the department and group I was working with, and they were rolled into the environmental and occupational health at Harvard School of Public Health. So I was working on this really awesome study, traveling all over North America. And one of the things I really realized is, guess what? They don't put really large trucking facilities in the best neighborhoods. That's like, might be like obvious, like, Kevin, you should have realized that. But when you're going to certain, like going to Mississippi, you're going to Alabama, you're going to Southern California, you're going to Mexico City, and you see the homes that are near these locations. We're not talking like small little delivery areas that I maybe was used to seeing in like Massachusetts, New Hampshire, and Vermont. We're talking, these are like massive fleet operations with tens of thousands of trucks potentially, and thousands of people working on them daily. And seeing that the neighborhoods around them, are predominantly areas of low income, high minority populations, high unemployment. And it made me want to think about, like, well, what were the drivers of this? Well, zoning is a major element to it, but zoning isn't its own piece. Zoning is a policy element. It's the application of it through something referred to as NIMBYs, or not in my backyard. So what that means is that higher, more affluent areas have much more political clout in order to maintain the separation of these types of industries from going into their areas. And only through strict enforcement and making sure that environmental justice is an element of that can we really start to see that these policies need to take in environmental justice in order to understand that the next siting of these facilities, we can't just put it in areas that already have these and where there's already an excess amount of pollution that people are being exposed to. I'm sorry, I'm not going to try to pontificate too much. It's just I get preachy sometimes. So you can stop me, Karen, if I go too far.
I think you're preaching to the choir here, so that's all right.
Yeah, I'm sorry. This is really, and I'm thinking back on my growing up, and this really hit home to me, and it was hitting me so hard at this time. After I remember going to a facility in Detroit and being on like where they talk about 8 Mile, like being there and talking with some of the mechanics and seeing just some horrible conditions, like individuals that were in their early 40s talking about already having multiple strokes. And these are very fit people because they're doing hard labor, lifting things, and seeing like individuals with goiters and growing out of the side of the neck, and just like, what can we do? And it's not just the facility. We put next to these facilities are like rendering plants and incinerators because of the way we do this. And just feeling like I couldn't stay and keep doing the type of cancer and cardiovascular. I wanted to affect policy, and I was doing so much hands-on. I actually got a little burnt out. I was like, this, traveling all over the world, like all over North America, doing this work constantly. I got burnt out. I said, I think I want to affect policy as a change. And I ended up working at Tufts during my master's, and I applied for a position because while at Harvard, one of the best things that happened is I worked for some great mentors. And they said, Kevin, you love the research, you love the science, but you love the policy, you love working with community and people. So it's maybe you want to try something else for a little bit. So I did. I went into Tufts University, and was getting a master's in urban and environmental policy and planning. Very long title, but essentially it's the intersection between environmental science and policy development. And you learn a lot about, not how you write legal briefs, but instead, how do you take science and translate it into useful policy elements to be implemented? And I was like, this is amazing. I want to keep doing this. And it was, the law classes were taught by EPA lawyers. I was so impressed, and I loved the whole program while I was there. And I also got a job because you got to pay bills, running the GIS center there, because I had learned GIS while I was at Harvard and working there. And that's where I ran and wrote my very first study to look at school-based asthma in Connecticut and proximity to roadways with a professor there. And we did this analysis as part of my master's thesis. And we got this, but it's also the first time that I ever did a really great analysis and learned about signing contracts with research. And that if you have to be very careful about your publication rights, because we wrote this up, we identified that where certain HEPA air filtration was being prioritized was going predominantly to non-Hispanic white affluent communities because they knew how to ask for them, and away from Hartford and the areas that actually could use them because of the high air pollution. Presented our results, and they, this is lovely. Can't publish it. So that's the last time I ever signed a document that said somebody has oversight over my publication. So if there's one thing you learn and you take away from today, and most universities protect their scientists and don't allow those sort of contracts to be signed, I never allow anyone to have oversight over publication rights of anything, myself, my students, or anyone on my team. So I learned a lot of things like the hard way. That's, beat it into my brain. So so I was working there for a while but I also had this passion for GIS that went beyond this. So I started working with nonprofits in the area, specifically Toxics Action Center, where I took in my free time a lot of the GIS work that I was learning and started to say, where are we positioning these sites, those TRI facilities that are located, and seeing what are the makeups of the communities around them to try and get at, is this something that we can fix in our problems? And working with nonprofits, it really made me realize, okay, my experience and skills as a data scientist is, as much as I want to maybe write policy and do that, I like working with data and I'm good at it. And it's an essential element and skill I can feel in my career is if I work as a data scientist who understands policy, who understands the biology, and can work with both those groups, the scientists and the policymakers, to translate that. That's something that I would like to do more of. And that led me to work with a couple different agencies. One is MEMA, Massachusetts Emergency Management Agency, and also the city of Cambridge, doing GIS and specialist work. However, while I was able to do a lot of science and working within a government-based structure, what I realized was that the timetable to affect change, to do the analysis I was looking at, actually see a difference come out, was just very, very long. And it wasn't where I felt my passion was. I felt it was not in the government piece. It was more on the academic side. And also, I loved meeting and talking with people. And I also, at this time, had started mentoring some undergrads in GIS that were working with me at City of Cambridge. And I was like, I like this mentor and I like this teaching stuff. So you notice, like, I figure things out. The best way I figure them out is by doing them and realize what I don't want to do. That's how I've started to narrow down and hone in on what I wanted to do and what that field was. And that's really where I discovered, I wanted to go back and start teaching. I became an adjunct faculty at Boston University, Metropolitan College, teaching GIS. And then I also became a doctoral student at the VU School of Public Health. And one of the reasons why I went into environmental health particularly is because it allows for a nice interdisciplinary focus. So if you look at schools of public health, the traditional tracks you'll have are things like health policy and law, epidemiology, biostatistics. And with environmental health, where you sit is really at the intersection of a lot of those. And when you get a PhD in environmental health, you aren't sitting for some massive exam or something like that that would be similar across the different fields. It's based on the research content area of your expertise. And typically, as an environmental health person, I had to receive training in biostatistics, epidemiology, which are essential, but also toxicology. So my biology train and organic chemistry became very helpful then as well, because not just knowing how to set up a right study, how to create DAGs and show how different confounders or things are mediators or moderators is important, but also being able to understand that if I'm going to study air pollution, I better understand and be able to understand the PAHs, the different metals, nickel, cadmium, and the other components that make up particulate matter, how they're going to cause inflammation both in the lungs and throughout my circulatory system, about, how they're going to introduce and increase IL-6, tumor necrosis factor alpha. And that's going to lead to a cascading effect of C-reactive protein and the innate immune response. And that causes a cascading amount of inflammation. So you have to have that training that you would get in those life sciences in environmental health, but it gives you the opportunity to blend it across a multitude of different disciplines as well. And to me, that was very engaging and something I wanted to be a part of. In addition to that was, oh, do we have a question?
Yes, we have a question.
Sure, go ahead.
So I think it's fascinating that you can point to courses you took at St. Mike's that you later on looked back on and said, oh, I'm glad I took that. It helped and so forth. What about in the area of data and data science and manipulation of data? We didn't have data science back then. I'm sure we offered statistics. Did you take statistics and additional math or anything?
Yeah, so I did. And this is a great point. When I took it, it was just like, there wasn't any sort of computer science or elements tied to it. It was just pure like, how do you calculate the mean, the standard deviation, like the median? How do you work on this? How do you do a simple regression? All in the basic math. A lot of it's taught in an applied experience where you do learn the basics of statistics, but also in a software simultaneously. To me, I was not at all really interested in statistics. I did not well in it while I was at St. Mike's. And there's something that clicked when I found the application, when we took it off of the blackboard in its abstract nature and put it into an applied experience, that it clicked for me. And I love statistics now. And that's a key thing. If you want to go into public health, that's a really, and you want to go into epidemiology, biostatistics, or environmental health, statistics plays a strong part of that as well. All of my doctoral students and master's students take at least mid-level biostatistics courses, but all taught in softwares in an applied experience as well. And that's really great question. Yeah, statistics is extremely important. I think it wasn't until I got out of the abstract and into the applied that it really started to hit home. And I still laugh today, like, why was I so poor at that in my undergrad? But then as soon as I got into an applied class, it's just, I was amazing. So it's great now. But really, one of the key things is I always like to talk about is the people. We talk about like, yes, Kevin, I did this. This is what I did. You don't do this on your own. You don't get through these academic pieces on your own. It's driven by other people that get you there. Your professors at St. Mike's is where it can start, but other people will help you along the way. It's through the guidance of those mentors and finding good mentors that I've been very fortunate about. I'm very lucky that my very first job out of university was with like world leading epidemiologists at Harvard School of Public Health. Francine Layden was like a huge influence. And while I worked for her from 2002 through 2005, and then she encouraged me to go to Tufts and then encouraged me and wrote letters of reference for me to go to BU. I actually 2 years ago wrote a grant with her and I'm working with her again. So the field of environmental health and environmental epidemiology is very small. Our annual conferences are international ones are approximately like, 1,500 people. That's it. So it's a very tiny community, and epidemiology is very big, but the sub-disciplines within that, infectious disease, the environmental epi, occupational health, each one of these have their own sub-disciplines within them, and it creates a really nice network of people once you start to go to conferences. I also say a nice way to find out like who you want to work with and what school you want to go to is go to the conferences and see the professors that you might want to work with as a master's student or so on, and see and find a mentor, because that PhD level work, it's really one-on-one, and it's about finding good people and having them be advocates and want to see you succeed and become a colleague of theirs in the future. And that's what I'm trying to do as a professor now, and pay that forward. And these are the people that have been instrumental to me, both at Harvard at Tufts, and at each one I've learned different things. I've learned from my colleague Francine how to be a good mentor, how to be a great data scientist, from people like Julian Adjman and Doug Brugge, why it's so important to ground your work in community and to have that be a central element so that you can draw comfort and love from the day-to-day grind of the work that you're doing, and make it applicable. So as much as I could hide in the library or in a lab or in a computer, it's really the interactions with people that drive me to want to work in this field. And of course, my BU colleagues and my Yale colleagues are great as well. I don't want to say anything about them, but I know I'm going way over. I'm a talker. So as you can see, I'll just keep going. So I'm going to take it to the next stage. Let's talk about what it's like in the life of an EH researcher. And really, I like the framing. I'm using our school motto, but I think it's apropos. It explains what I like to do and how I do every day and how I approach my day. It's really around think, teach, do. The think is the academic elements to this, the research, the grants. I predominantly work in air pollution, social determinants of health, environmental justice, and climate change. Every day I might wake up and a lot of my days spent in meetings. It's spent writing code. It's spent writing grants. It's spent writing research papers. None of those are done by myself. I don't do any one of these points in isolation. I might be working on a Google Doc with a doctoral student, a master's student, a research assistant, and another professor. We might be all at the same time in the Google Doc writing the paper or the grant together. So it's very highly connective. Other things that I might do on a typical day is teach, depend upon what I'm doing. I teach GIS for public health decision making. I also teach advanced GIS for public health as well, and mentoring. One of the things I really love and draw huge amounts of strength from is my master's and doctoral students and DRPH students as well. And the idea here is that they're the ones that come up with really creative ideas. You as undergrads are going to be the ones to fix and find the solutions. I'm trying to help guide and teach skill sets to do that. But some of the best ideas that I hear are from the new students. They say, well, have you thought about looking at this? No, I haven't. So let's talk more about this and let's come up with a plan and maybe see a way to solve this or get a solution or helping to prioritize these. As the mentor side of this, my job is to make sure that one, you have a direction, something that's achievable and feasible, not to limit what you're trying to achieve and hinder your experiences in trying to develop your own lines of independent thinking, but instead to say, these are potential other directions, other resources. These are steps that you need to know if you want to do these other pieces and guide them onto their next phase. And just, I talk a lot about like there's masters and PhD, and I also have DRPH students, all have different skills and all have different levels of depth they'll go into a topic. A master's, a public health student might only interact with me if I'm their advisee occasionally, once a month, and I'll advise them on that. Some might work directly with me. And then others that go on to work in a PhD, it's weekly meetings and they're a part of the team and the team efforts. The do really revolves around what I like to refer to as community-based participatory research. This is a deep passion of mine. If anyone wants me to talk about research, I have all sorts of slides on that as well. But essentially, CBPR to me has really been a central element of my learning and then also the work I want to continue. What that means to me, and it means different researchers might talk to, essentially is that when I have a problem in a new research study, I don't just go to my community partners that it took years to develop relationships with in Somerville and in Chinatown and in other areas or backgrounds. Instead, what I do is I go to them and say, what problems are you having? Or they'll come to me and say, Kevin, we have this new policy. This actually happened just, 6 months ago. And then a year before it happened with another topic. But they say, we have a policy around increasing greenness in the city of Somerville. It's a major problem. Want to figure out a way to do it. Can you come and provide testimony as a scientist on this topic? And that's something I do for my community partners. I'll write briefs, I'll write notes and say, like, this is what we know to date on the benefits of greenness, from tree canopies to shrub to forest. improves not only cardiovascular, physical activity, but social cohesion. Here's the studies that prove this. Here's the meta-analyses that show the incremental improvements that you'll receive from this. But then when we have a new problem, as opposed to them to find a solution, we come up with the research questions together, we write the grants together, and then me and my students, when we have meetings, we don't say like, oh, we'll see you when we get our results. They're in those meetings. So my students have to learn how to communicate not only to a scientist, but make it understandable to anybody that is in a community partnership as well. That's a key thing to learn. And that's something specifically at BU, and in my department specifically, we prioritize, is working with communities, taking your science and being able to communicate it so anyone can understand. So the do side is really essential to the work I do. And it's not only just working with community members, it's then working with like the Massachusetts Department of Public Health to understand where to set up interventions on COVID-19. So that's like the newest piece we're doing, or working nationally now with Blue Zones, which is a private entity that does, they work with communities, especially low income or communities of color, to identify how we can improve through like actually improving things like bringing in funds to improve walkways, to improve walkability, access to healthy food options through providing funds or support through state agencies on things like access to fruit and vegetables, and trying to target these interventions. Right now, we're helping them to do targeted vaccine distribution in places in Georgia that are very rural right now. That all requires GIS, it requires some statistics, but it also requires you the ability to communicate with local community organizations to drive that.
Kevin, let's give you a break, and I
No
know
problem.
some students who have some questions, but
Let's dive in. Yeah, I'll turn this off for a minute.
Entree into your path, and I'm sure they'll have some questions about their own paths. So people
Sure.
can just, you can either raise your hand electronically or just speak right out and ask the question. That would be fine too.
Yeah, I'm used to lecturing for 3 hours at a time. So
Oh my God.
What is the biggest mistake you've seen students make in graduate school?
what is the greatest mistake I've seen them make? Oh,
Well,
that's
not like biggest mistake. Like, what's the one thing like you see happen all the time and you want to like look at them and be like, just don't do that, or try and do it a different way?
That's great. Great question. I can actually think of, there's a couple different applications. There's like, the first I'll start off with is going to graduate school just because you think you need to do that. That is probably the number one thing. The idea is that you want to try to figure out what it is. You might know coming right out of undergrad and say, I want to go in and get an MPH, or I want to go get a master's of science in, climate studies or something like that. You might know, but if you just going into a program and saying, I'm going to figure it out like you would with an undergrad is something I caution students against, just because it's one of the things you're trying to set yourself up for what would be that next final stage. And while it's a natural trajectory for students who want to go right from one to the next, you want to make sure that's it. For the master's, it's a little bit less important as it is for the PhD. The PhD, you're making a commitment for 4 to 5 years. You're going to be there, if not potentially even longer. So you're dedicating yourself to becoming an expert in a very specific topic area. So on the PhD side, you really want to make sure that you've narrowed down, one, that you want to commit yourself to working in this field, and then 2, that you've identified the right team and mentor to be a part of, because you're signing up for a long social pact with not just the academic training, but also with that collaboration. You're signing on to work sometimes with 1 mentor, 2 mentors, or 3 mentors at a time, and want to make sure those are the right fits. For the master's, if you know you want to work in public health, you can go and get an MPH and start to triangulate that. And a lot of MPH programs are now built towards that. When I was in getting my master's program, it was much more single line, where you would go in and say, you're going to just do epidemiology, you're going to do biostatistics. Now you get what's referred to as certificates. So you get an MPH, but you can dabble in biostatistics, you can dabble in epidemiology, and choose your tracks after 1 semester. A lot of schools, Harvard transitioned to that, Columbia did, and we have as well. So I know that's opened it up, so it's not as catastrophic if somebody decides they want to come in and then they decide after a semester, like, I really don't want to do this, and they have to start all over. Like if they want to switch from epi to public health policy and law, then you're not missing anything. Now it's the first year is predominantly script written for most students. Good questions to start. Any other nice tough ones? I like this.
I have one. So kind of through like my classes, I've definitely heard about like racial disparities between like pregnancy outcomes. Have you done any research in that, or can you talk about any of your findings related to maternal health?
Yeah, absolutely. There's actually a lot that we do. In terms of disparities, I work at one of the centers I work on is the Center for Research on Environmental and Social Stressors in Housing, and it's a disparity center from the National Institute of Minority Health and Disease, and it's set up to just study this. In terms of maternal health, yeah, I work on a couple different ones. One is on the children, and then I have my own cohort that I've built of women that have come through Boston Medical Center, which is the hospital affiliated with BU, and we're looking at not just what are the inequities or what are the potential problems in terms of pregnancy outcomes. Specifically, one of the ones we just submitted a paper on is polycystic ovarian syndrome, or PCOS, and trying to identify that in medical records, but then on inequalities. The BMC is a population that is predominantly minority, predominantly non-English speaking, and predominantly low income, with a high percentage of over 32% living in poverty. So that population is one that you can identify what are some of the strongest predictors. And we have a recent group publication that looks at it with children and not with the mothers of these cohorts. But essentially, we did a multi-exposure analysis looking at PM 2.5, air pollution. We looked at walkability, greenness, and some of the most important factors were whether or not a mother was on WIC or SNAP. That really made a huge difference. And that's an actionable step, right? That's really important to know, especially in light of what's happening right now in the ideas of previous administration trying to actually cut WIC and SNAP and saying, if you do this, babies are going to be potentially not able to grow effectively, and you're going to have increased potentially in different complications down the road from that across the life course of the children as well. And be able to direct that. In terms of racial equity stuff, one other thing I'm going to talk about is we're moving away from strictly looking at race ethnicity on its own. Because what does that actually tell us? When we're looking at things like percent Black, percent Hispanic Latinx, that's not really what we're interested in when we put that in a model. We want to know about the systems of oppression, the systems of racism, how that drives towards it. And instead, what we're looking at is things like we integrate in redlining, we integrate in racial segregation measures. And we're looking at those because those are the actual spatial applications of inequity that have been set up, as opposed to race ethnicity. We still control for race ethnicity, but we put these other variables in and see that those are more important, and they tell us something contextually that can be acted upon.
Kevin, I have a question.
Sure.
And that is, a lot of our students these days, want to work for a couple of years before they go to grad school. And I think for the reason you mentioned, and for other just sometimes economic reasons, that does make sense. Gives them time to find out what they really want to do. With a bachelor's degree, a BS in biology or environmental science or health science or public health, coming out of St. Michael's, what would you suggest to people in terms of looking for those first jobs or those first work experiences, if they want to hopefully have an experience something like what you did to find their way, and their passions?
Sure. Great. Yeah, I can definitely talk to my experience. Coming out with a BS, a BA, you can do quite a bit. You can go work in different hospitals doing data analytics. You can work at research institutes. You can work at nonprofits, especially if you're coming out with some statistical, computer programming, and GIS-based skills. I'm not always trying to push GIS, but it's sort of like every time I'm seeing a position open, especially research assistant, research coordinator, those two jobs, if you want to work in research, those are like the initial jobs that are open immediately. And the nice part is a lot of those jobs are at academic institutions and areas where there are graduate degrees. So a nice element is if you want to find out, do you want to work in one of these fields, whether it's public health, whether it's environmental sciences, environmental engineering, many different schools across the country hire people right out of undergrad with these types of degrees, just like I did. And a benefit of that is typically tuition reimbursement.
Yeah.
So you can get a lot of your masters, you can take classes, see if that's the direction you want to go. If you don't like that one, you can switch over to like another program and really test the waters on potentially different programs while you're working and getting funds. I mean, that's a nice thing I recommend to students is to, if you want to go on to higher education, you don't want to dive in right yet, if you can get a position at a research institute or an academic institution.
Okay. Who else has a question for him?
This is Richard Guyava. Kevin, I have a couple questions.
Sure.
I really enjoyed your talk. The questions I wanted to ask are really, I'm a geographer and I teach mapping and sort of entry-level GIS stuff. If a student can't take GIS, and I teach environmental policy, and so I sort of orient students to mapping and so on, what's your feeling about platforms like the Environmental Justice Screen Tool or EasyRECE, which is a risk analysis platform? Yeah. I'm trying to tell kids, look, if you can't get in GIS, we don't have a massive amount of GIS slots. I teach a mapping class, so some students take that. But if students just wanted to sort of dabble, what do you think of those platforms? And what do you think of, for example, the Massachusetts has Oliver as its GIS, public GIS stuff. Is that stuff worth us as faculty pointing people to and engaging them in? Because it seems like the learning curve in those contexts is a bit lower than learning ArcPro or, becoming good at QGIS. I'd love to hear your thoughts.
Yeah, sure. That's a great one. I get asked it a lot for students, even at the graduate level, who weren't able to get in, or they're like, I couldn't fit it into my schedule. I'm here. Can you help me figure something out? A couple different resources I can direct you to. I teach in both Q and ArcPro and Arc Online because GIS, I always like to tell people, it's not one software, it's a field. And some things work better in applications on like Geoda, I might use for one thing. I might go over to QGIS for zonal processing and ArcPro because they got all the Esri data. I like working with them. So a couple of things is, the environmental justice screening tool, Oliver, those are good ways to get an entry level to understand about what online dashboard works and how you can work and download data. Some of the next step levels would be getting things like an ArcGIS Online account, and there's tons of free tutorials in ArcGIS Online. Also, USAID, DHS Spatial GIS Repository, where you can get a lot of international and global-based health, has QGIS-based tutorials on their website that are basically what would be the equivalent of most intro GIS, the first 3 classes, like how do you read in shapefiles, how do you manipulate those, and how do you do that work. Oh, thanks, Kristen. So I mean, I think those tools are good, but they're only really dashboard and elements. The environmental justice screening tool I have a different problem with, how they classify and quantify environmental quality index, but they're aware of that. So, but they're great entry points to see if you're fascinated and interested in the mapping field and you want it diverse. There's also a lot of workshops that are available around, not to plug more of the things that I do, but I also teach a fully online, I have for the last 4 years, where it's a crash course. It's basically the equivalent of the first 7 lectures of Intro GIS in 3 days. So there's like a bunch of these sort of intensive workshops at different places, and they're actually pretty cost effective, like less than $500. So
that's excellent. Thanks.
Sure.
I mean, it sounds like those of us who are faculty need to think about ways to incorporate some of these data science opportunities into all of our courses, because it's clearly going to be important in almost every field in the future.
Yeah, it's sort of, when I was just starting at the School of Public Health, GIS was there was one professor there that was teaching it, and while I was a doc student, I was teaching on the Charles River campus because there just wasn't enough people that knew it and knew it in applied ways as well. So one thing I always like to tell my students is, you're taking a GIS class, you're people who get PhDs in geography. So we're dabbling in and playing in other people's sandboxes. So you got to learn the language, you got to learn the lingo, and you got to learn what you're going to do. But that's plenty you need typically to go work for a Department of Public Health. You just need some basics. You don't even need a full semester of a class. A lot of times also those jobs will send you for training. That's the other thing. Like if you're working at an entry-level position at a Department of Public Health with just a bachelor's and you indicate that you want to learn GIS, a lot of them will send you. Because I get a lot of people taking my summer one from all different parts of the country. And they're like, yeah, I use my development funds to go and learn GIS.
And that brings up the to emphasize what you said before about working at an academic institution or even a government institution. Take advantage of those professional development opportunities whenever you can. So we've got time for just one or two more questions, and then I know Kevin, I can post your publication list for people who might want to follow up on some of your research. But we have a couple more quick questions for Kevin.
I have a question about just your experience in general, and it's kind of a two-part question. The first part of the question was, which one of your classes at St. Mike's was the most beneficial for kind of realizing what you want to do in life? And then the second was, I guess, more like experience-based, which experience in your life, because I know you have a lot of experiences, was the most, I guess, the strongest in telling you, oh, this is what I want to do.
Really great questions. Thank you. So I'll start with the first one. I think it has to do with actually public policy. And it was a class, and that led also into doing an independent study with Professor Siplong, and trying to think about, all the stuff that we had learned, like how do you turn it into something actionable? It's like we learned all these different pieces and really think it through, if we want to improve society as a whole, that global perspective, you need to take on the little bits of it. As much as we want to fix everything at once, we got to target certain things. And reading, I think it was Public Paradox, I think it was, is one of the books that we had to read. And it was very inspirational in reading about certain, so the plan and aspects of this. That's one class that always sticks out in my mind and sort of like framing. Also another professor, I think he's retired now, Professor Grover's senior seminar class as well. That was very moving. And one of the reasons that I also, I had a very strong inclination towards this idea of citizenship and wanted to be an active citizen to affect good in my life. And the skills that I have, I get approached by private organizations to come and lead. That's one of the benefits I don't very like to hide from people. When we work in public health, we do so because we're passionate about it. And that takes a dedication. A lot of the skills that we learn could be quite, beneficial and lucrative in other fields, but I want to contribute to a better society and in making improvements for myself and those to come. And I think it's rooted in a lot of the education I received while at St. Mike's around these topics of community, and really holding that as I move forward. It's also, that happened to be while I was taking that senior seminar as part of the political piece, Dr. Grover's class, was when 9/11 happened as well. So I was in class when that happened, and we were all in classes. And I remember just being like moved and trying, like being in a small Vermont campus and having to think about these problems in the world, and how can we then for the next year just spend time thinking about like how can we help improve inequities, not just here in the US, but across the globe. And that's one of the things I do in India and other places as well. And sorry, I got a little dramatic there. Let me pull it back on the other question. So what was your other part? What was?
Yeah, that was great. Thank you. The second part of the question was which, like in real world experience was the most gainful for realizing what you wanted to do?
Oh, yes. I think it would probably be, it wasn't any one thing. I say the one person was at one application was Doug Briggy, who was at Tufts and now is chair at UConn in community health. And while I was his research assistant, he brought me down to the Chinatown Progressive Association, and we were inside of one of the schools and seeing like the amount of children in the data that had asthma, and then visually seeing the mold and things like that on the school building, and the teachers and everyone there, the administrators, they were so passionate about it, but they needed information and data from just a small group of us to be able to help provide the support of evidence to the city to look at why we should put that in. And that really had a transformative change, talking and going through that process and providing them with that data to show that like the air levels were leading to increased amounts of kids missing school days because it was exacerbating their asthma. And seeing that lead to change, that really changed my direction of considering potentially going back more into a policy route to say, I can do something effective here, given the data science, my enjoyment of working with data, and my knowledge of policy simultaneously.
Thank you.
You know, your statements about wanting to serve and to make the community better and so forth. I've talked to a number of alums over the years, and many of them have that same philosophy and sort of goal in their lives, and find ways, and they point back to their St. Mike's experience and the community here as being instrumental in helping them develop that, that feeling. And they find ways to incorporate service and community health, if you will, and being a good citizen, not just into their professional lives, but just their personal lives as well. So it's kind of nice to hear that again and again. So. Okay, one more quick question, and then we will all head off to dinner or whatever, or writing grants, Kevin.
Yeah.
Anybody else? One last question?
So I read one of the papers that you are a co-author on in North Carolina. And I just wondered, and this is much more of a sort of personal thing. It's not somebody I knew personally, but in my own sort of little environmental justice corner of geography, I've used a lot of Steve Wing's work in North Carolina. Yeah. And I just wondered, because I've always thought of him and his pathway and people I know personally who knew him. I just wondered if he had sort of crossed into your world and if you had any thoughts on that.
Yes. He was actually a big inspiration to my dissertation advisor work. She worked on some of the CAFOs and issues in North Carolina along that. Yes. Some of the best and brightest and people that pulled too early on this earth, and Steve Wing is definitely one of them. And that sort of work definitely has been inspirational. The North Carolina work that I did with the team from Yale and Rice University and others, that's one of the things I like to do. I don't get that paper particularly. I wasn't funded to do that. There's a whole bunch of papers where I'm not funded to do that work. I do it out of my own time and the desire to help different groups. And by I'm really big in, I didn't talk about it today, I'll talk about it next week, is data, making data more accessible to all people, all teams, all researchers, all communities. And that just happened to be another paper where the data sets I was building nationally through some collaborators, they said, can we use these data sets to help, and then ask you to inform on them as well and help write the paper. And I was more than happy to put that time in and aside to do it. So
thank you so much.
Sure.
So just a reminder to people that Kevin's going to be giving a colloquium seminar next Friday. I think it is, Kevin, right?
Yep.
So I'll make sure that everyone gets a copy of that announcement. So if you want to dig into his research with him a little bit more, he'll have time to do that then. But thank you very much, Kevin. I really appreciate this. It was terrific.
Thanks, everyone.
Thank you.
All right.
Bye, everybody.
Thanks for inviting me. Take care.
Thank
Thank
you.
you.
Thank
Thank
you.
you.
Thank you.